In the end, we have to look at what is best for the patient. So if the patient has sufficient bone to place 6 implants, 8 implants, that is the ideal thing to do for them. Because as we can see here in this x-ray, this patient has sufficient bone in the lower jaw to place 6 implants. This doctor chose to do standardized Palomalo ALL-ON-4 to avoid the nerve. He had plenty of room to get closer to the nerve. And the only reason I want to show this x-ray and show these cases is so, one, to educate patients who are going through the procedure or are thinking about going through the procedure, or maybe in the process of the procedure, or possibly having complications from the procedure. Dental implants are a wonderful way to replace such a vital organ in our body, which is our mouth. If we can restore our mouth, our smile, the functionality, the biomimetics, the way it works, the aesthetics, it's a life-changing procedure, but it has to be done with critical care. And so let's take a look at some cases. These are just cases that I've seen just this month. We see cases every single month of patients who have been through the process. They've spent a lot of money, a lot of time, and now they're having to have it all redone again. And so, but if the dentist will just think as an engineer and think of the biomechanics, I really don't think anybody would be doing ALL-ON-4, because biomechanically it makes 0 sense when you have all of the implants concentrated in the front of the jaw. So let's take a look at this image. This is just from the iCat, from the 3D model. This was a patient who came to me who had the ALL-ON-4 procedure, was having chronic pain in her premaxilla in the upper front of her jaw. Every time she bit down, she was having pain. And to me, it just made perfect sense. She had been to multiple other doctors who had were scratching their head as to why this pain was occurring. Some of them were calling her crazy. But I could see it. I could see that the load factors were not favorable for her situation. She had way too much load in the front of the jaw. And I knew that if I could transition that load and put more implants in so that the load is being carried more towards the back and have a nice even distribution of implants, that it would solve this chronic pain problem. She said if she ever went out to dinner, every time she ate and bit down, there was this sense of pain. And so, after having spent $60,000 and then putting the prosthesis in and the teeth in, and then all of a sudden having this problem, chronic, constant pain, she wasn't too thrilled about that. So here I have an image of her, and you can see they angulated the 2 posterior distal implants. They put the 2 anterior implants, just standard ALL-ON-4 procedure, cantilevered, probably 10 to 12 millimeters off the posterior of the back implant, and then put the teeth in and just said, okay, we're done, you're good to go. And so now, of course, compared to dentures, there's this is a lot better, but the cost for an ALL-ON-4 procedure is very much more than the cost for dentures. So let's take a look at some other x-rays, and hopefully you can see these, so you can see some of these pitfalls that we're seeing. So whether you're a doctor placing implants or your patients who are considering the procedure, you can think about some of these issues prior to moving forward with the treatment. And so, of course, after evaluating the patient, getting a CAT scan, determining what she had, and determining what she needed, we went ahead and we placed additional implants in the back of the upper jaw. I had to remake that prosthesis or teeth because obviously I can't retrofit it. I had to start over, basically. The other thing she was missing was the implants on the lower. So she had no lower teeth. The doctors who did this case originally did an ALL-ON-4 on the upper, and she was missing all of her lowers. And so she simply only had her front lower teeth. So all of that force was just beating up against the premaxilla. So we added more implants on the upper, placed implants on the lower, and now when you look at her after, you know, it looks beautiful. But most importantly, the load factors, when she chews or she bites here or she bites over here, it's even, it's the same. And so, and also in the front, so that when she bites down, there's not one point throughout her mouth that's getting more load than another. It's very even. And guess what? After going through that process, the pain's gone. And it's because it's a biomechanical procedure. We have to consider the biomechanics. We have to consider how it functions, how it articulates, so that in the end, and also it protects the prosthesis. So I won't have a fracture here because I have created a situation that is favorable, that's balanced, and that the loads will allow for this to last her the rest of her life. It's the only reason why I would say that. I would never consider, for example, let's say she came to me and said, you know what, I only want you to do the top. I don't want you to put any implants on the bottom. I would say I'm not doing it. I'm not touching it. Why? Because I'm not going to solve the problem. I solved the problem by adding implants in the back and making sure that the entire system was in balance. And so, you know, as patients, as they come to me, you know, sometimes they just want like the upper or the lower done. And, you know, for me, it's most important that the entire thing is in balance. It protects the patient, you as a patient, and it protects me as the doctor if I do everything, you know, by the book, using the best materials, best surgical techniques, and the best prosthodontic techniques.